Good morning and welcome to Health and Social Services for November 7th. Can I have a call of the roll? Thank you very much. And majority of the committee is online, so I do have a visual of you on my screen. And for those who are part of the committee, for raising of your hand would be of an assistance for moving and seconding. I do have Chair Henry here as well too. I'm looking for any declarations of pecuniary interest from any members on the agenda. Hearing none, seeing none. Moving on to the adoption of the minutes from October 3rd. Can I have a mover? Chair Henry, second, please. Mayor Carter. Any opposed? Next, we're going to turn to Tara Supancic, Senior Environmental Health Specialist, and Alex Swirsky, Epidemiologist, Climate Change and Health in Durham Region, assessing the impacts of extreme heat, and both are online. Tara, would you like to start?
Through you, Madam Chair. Thank you, and good morning, everyone. Are you able to see the slides? Thank you. So my name is Tara Zupancic. I am the Climate Change and Health Specialist in Durham Region Health Department, and I'm here with Alex Swirsky, Epidemiologist, and co-author of our series on climate change and health in Durham Region. And today we are sharing the first vulnerability assessment in the series, which focuses on extreme heat. Next slide, please. Thanks. So this morning we will provide a quick overview of the Climate and Health Report series, and then we will dive into the Extreme Heat Report. We will outline our assessment framework, go over the main findings, highlight some gaps as well as local strengths related to heat resilience, and then lastly we'll talk about next steps. Next slide, please. So why are we assessing climate change and health vulnerability? And there are many reasons for this. To begin with, Durham Region Health Department is mandated to conduct health vulnerability assessments under the Ontario Public Health Standards, and this includes health impacts related to climate change. But secondly, we know that health impacts from climate change are on the rise. We know that healthcare systems will be stressed by a wide range of climate-driven emergencies. And we also know that some people face greater health risks from climate hazards than others. And it's what we call a threat multiplier, making life even more difficult for people who are already facing health and socioeconomic challenges. And then lastly, we really want to stress this point is that many health impacts are preventable with preparation. However, results of a recent public health survey showed that although Durham Region is already experiencing the effects of climate change, most residents do not believe that they will be harmed by it in their lifetime. So there is a real and genuine need to better understand and communicate these risks, as well as actions that we can all take to reduce them. Next slide, please. So as many of you may already know, we're in the process of completing 7 reports in the special series called Understanding the Local Health Impacts of Climate Change. The first report, which we lovingly call the primer, was released in August, and then it's followed by 6 climate change and health vulnerability assessments that are organized by climate hazards to break it down and make the overall report more digestible. So it's broken down into extreme heat, extreme weather, vector-borne disease, food and water impacts, air quality, and solar UV radiation. So the Extreme Heat Vulnerability Assessment was released on September 23rd, and it will be the focus of the rest of this presentation. Next slide, please. So the Extreme Heat Report characterizes both current and future health impacts of extreme heat in our region and applies an equity-focused framework. Similar to the primer, we also incorporated the guidance and perspectives of the Mississaugas of Scugog Island First Nation. So as many of us know, climate change is projected to increase the frequency, intensity, and duration of extreme heat events. So this assessment has 4 main objectives. The first is to improve our knowledge and understanding of the health impacts of extreme heat. The second is to assess and report on available extreme heat data and evidence that may impact the health of residents, again, both now and in the future. The third is to prioritize health equity. And by this, we mean getting a much better understanding of people in our community who may be hit worst and first by extreme heat. These are often people who are already experiencing health barriers and health inequities. And the last objective is to establish a baseline for analysis for future monitoring and future assessment. Next slide, please. So then the question comes up, what do we mean by extreme heat vulnerability? In the context of climate change, we talk about factors of vulnerability as opposed to vulnerable people, and this is a very important distinction. Many climate vulnerabilities are the result of health inequities, often out of people's control. So while they're affected by vulnerabilities, they themselves may not be inherently vulnerable, and labeling them as such can be stigmatizing and harmful. So we try to avoid calling people vulnerable and instead focus on factors of vulnerability. As many of you know, extreme heat events are now the deadliest weather-related events in Canada. They're associated with illness, pregnancy complications, hospitalization, and death. Extreme heat affects some people more than others. Health risks and impacts depend on the three main factors that are depicted on this slide: exposure, sensitivity, and adaptive capacity. So for example, a person who works outdoors or lacks air conditioning may have greater heat exposure, and this is fairly straightforward. Sensitivity is when a person is more affected by heat compared to others due to factors such as age, genetics, or health status. So to give you an example, older adults or people with certain health conditions have greater difficulty sensing the heat as well as regulating their body temperature. And then the last factor, and in many ways this is the most important, is adaptive capacity. This is the ability of a person or a community to protect themselves. And this is where community level connections, relationships, and supports are so critical during an extreme heat event. So at the center of this diagram, people who experience all three factors of heat vulnerability are at greatest risk of serious harm from extreme heat. So as another example, an older adult who lives alone without air conditioning would be experiencing all three factors of heat vulnerability and would be at high risk of harm during an extreme heat event. So this is where we want to put our attention, on priority populations that we have listed on the left, especially those who experience significant barriers to protecting their health. So with that, I will hand it over to Alex to share some of the findings from our report. Next slide, please.
Thanks, Tara. So in the coming decades, all Durham Region residents can expect greater exposure to extreme heat due to expected increases in the number of extreme heat days, extreme heat events, tropical nights, and longer summer seasons. For example, the number of extreme heat events or heat waves are anticipated to double between 2050 and 2080. Additionally, urban heat islands are expected to expand within the region from increased development of housing and infrastructure needed to accommodate our rapidly growing population. It's important to keep in mind that climate projections are based on computer simulations that represent the global climate system. Although these models can be scaled down to represent trends at a local level, the projections represent average trends over longer time periods. This means we can't predict the timing of local heat events, so we need to start preparing for extreme heat events and emergencies now. Next slide, please. Human development processes like deforestation and land use change have contributed to local extreme heat vulnerability. As residents experience increasing exposure to extreme heat, so will the natural environment. This connection is crucial, and there is a need to protect and enhance our natural environments, especially since our environment and diverse ecosystems are crucial to extreme heat mitigation and resilience in the region. Heat-tolerant, nature-based solutions that can cool neighborhoods and increase heat resilience are particularly important for counteracting the increased land surface temperatures associated with the projected expansion of urban heat islands. Next slide, please. So what do we know about heat-related health burdens in Durham Region? We know that heat-related emergency room visits are associated with the number of days with maximum temperatures above 30 degrees Celsius. For example, analysis from 2005 to 2017 found that years with 6 or more maximum temperature days had higher rates of heat-related emergency room visits. So as the number of days above 30 degrees increases due to climate change, the number of individuals requiring medical attention due to heat-related illness is also expected to increase. Increased risk of heat-related illness is associated with older age. Yet most Durham Region Emergency Department visits attributed to heat-related illness were among the 25 to 44-year-old age group, followed by the 18 to 24-year-old age group. So it's suspected that environmental illnesses such as heat exhaustion, fainting, and heat stroke is more likely attributed to younger people when the illness cannot be explained by another pre-existing health condition. This also suggests that heat-related illness among older adults may be underreported because emergency department records may not attribute the heat to exacerbating a pre-existing condition. This highlights the need for a systematic approach to understanding the burden of heat-related illness in Ontario as well as Durham Region. We also know that relentless overnight indoor heat exposure, also known as tropical nights, is a serious risk factor for heat-related illness and death. It's important to develop health communications about surviving overnight temperatures as opposed to simply daytime advice for staying cool. Next slide, please. So where are more severe health impacts expected? Although we know that all Durham Region residents can expect future exposure to extreme heat, it's important to highlight that extreme and deadly heat events are already happening and we need to be prepared. Several building characteristics like no air conditioning, southern exposure, poor insulation, and location in an urban heat island have been associated with high indoor air temperatures. People who live in homes with characteristics that lead to indoor overheating are at much greater risk of experiencing heat-related illness or mortality. The risk is highest for those who do not have in-home mechanical cooling or air conditioning, as extensive evidence has demonstrated that air conditioning is one of the most effective ways to reduce heat exposure and prevent illness and mortality during extreme heat events. Although data are limited, we know that living alone in a low-income neighborhood and in a rented home are associated with a lack of air conditioning. We may be able to use these characteristics as proxy indicators to identify areas within our communities at higher risk of indoor overheating and a lack of air conditioning. Residents living in urban heat islands of Pickering, Ajax, Whitby, and Oshawa may be more exposed to higher than forecasted temperatures due to the urban heat island effect, and their exposure may be magnified if their home has characteristics that lead to indoor overheating or if they don't have in-home air conditioning. We also know that some people are more sensitive to heat than others, and there's strong evidence of a social gradient of heat-related health impacts. Heat-related health risks are not evenly distributed across sensitive populations, but are often more prevalent among those experiencing multiple health inequities. Consequently, negative health impacts may be greatest among residents living in Durham's 7 priority health neighborhoods, as these neighborhoods generally have greater health inequities and higher rates of chronic health conditions like asthma or heart disease that can increase the risk of heat-related illness and mortality. Additionally, these neighborhoods are located in urban heat islands and have the highest proportion of rented homes, which are more likely to have building characteristics associated with higher indoor air temperatures, as well as a lack of access to in-home air conditioning, leading to increased exposures to extreme heat. Next slide, please. So we talked about priority settings. Now what about priority people? Durham Region residents experiencing multiple forms of social and material deprivation, so under-supported people and communities, are expected to be impacted first and worst by extreme heat events. Some residents experience financial hardship, inadequate housing, food insecurity, and a lack of support. These factors increase their risk of harm during extreme heat events. There's also strong evidence of a social gradient of heat-related health impacts. So when we consider priority populations, we generally want to prioritize healthy indoor temperatures among those who experience multiple and compounded risk factors, such as those who live alone, experience low income, experience health barriers, and are dependent on a caregiver. This highlights the need to consider upstream interventions that support under-resourced individuals and neighborhoods. Next slide, please, and back to Tara.
Thank you, Alex. Our report also highlighted important local strengths that support heat resilience. So, for example, Durham Region has a rich network of forests, wetlands, grasslands, and water bodies, which are all crucial to heat mitigation and require protection and enhancement. We also have tree planting incentive programs as well as strong local shade policies. So to give you an example, in 2023, the Ontario Health Prevention System Quality Index identified Ajax as one of 4 municipalities in Ontario with the strongest shade policies, just with the caveat that it was limited to municipalities with a population over 100,000. Next slide, please. We also have a rapidly growing subscribership to Durham Region's heat warning and information system, and it provides our community partners with advance warning of extreme heat events so that they can activate their heat response plans. But in addition, it also offers information on preparing for and responding to extreme heat and promotes our resources to help people recognize the early signs of heat illness and to know what to do. And as you know, the region also has the very successful region-wide Durham Greener Homes program, and it includes income-qualified incentives for air source heat pumps that can provide cooling to low-income households. And we also have the region's energy efficiency and resilience strategy for the Durham Regional Local Housing Corporation. Next slide, please. The report also identified some important knowledge gaps that we need to address. So this includes a better understanding of heat-related health burdens in Durham Region, which Alex touched on. We also need improved local data and understanding of Durham Region residents living with disabilities, and then connected to that is methods for identifying and reaching isolated individuals during heat waves. Next slide, please. We also need information on local households without cooling systems and their heat coping barriers and needs. So it's not simply getting a list of who has cooling and who doesn't, but among those who don't, why don't they have it? What are their barriers? And then in the absence of that, what do they do during a heat event? We also need a better understanding of the distribution, accessibility, and use of cooling centers. And similar to this, it's not just about where they are and who uses them, but perhaps more importantly, who doesn't use them, who can't access them, and why. And finally, we need to identify community spaces at a much finer scale that are in need of shade, green space, or water features. Next slide, please. So in terms of our next steps, the report has been posted on our webpage and shared with municipal and community partners, and it's our hope that it will be used by decision makers to better understand and prepare for extreme heat in Durham Region to minimize these health impacts. We also know that community engagement will be an essential step to foster strong networks and to better understand community needs and priorities and barriers, especially as we mentioned those most affected and least protected. So these steps are presented in a cycle because we recognize that it's a continuous process of learning and action, but together we hope to increase our preparedness and resilience to extreme heat and protect the health of our communities and our families. Next slide, please. So we know this was a very content-heavy presentation, so we wanted to leave you with 4 main key messages. Number 1, we need to be prepared. Extreme heat is intensifying, but we can't predict when or how severe an event will be, so we need to be ready ahead of time. Number 2, health systems can be quickly overwhelmed, so community level knowledge and education about how to get ready before the heat hits, who's at greatest risk, what heat illness looks like, and what we can do about it is going to be essential to protecting our communities and health system capacity. Ideally, we want to prevent people from calling 911. Number 3, we need to place more emphasis and preparedness on preventing indoor overheating because this is where the greatest number and most severe health impacts have occurred in other jurisdictions. And finally, and perhaps most importantly, while health impacts can be severe and tragic, they are also highly preventable with preparation. Next slide, please. Thank you very much for your time this morning.
Thank you very much, Tara and Alex. First on our speakers list is Mayor Foster.
Thanks, Chair Roy. Oh, here, I'm going to do this. Can you hear me all right?
Yeah, perfect.
Okay, good. Thank you. So Tara, Alex, a quick question. Many other spots on the planet, societies have had to deal with heat that we have not had to. Air conditioning, great, but it's sort of a catch-22 situation where the more air conditioning we use, the more we impact climate change in a negative fashion. Are we learning from other societies? Are we learning from groups that have not had access, to air conditioning but have managed to cope? And the answer is perhaps they don't cope as well as we think they do.
Thank you. It's a very important question with a complicated answer, like these issues often do. There's a couple of pieces. In terms of the evidence base, we know that air conditioning is the single most effective way to protect people's health. And we know from some other communities that are sort of speaking on behalf of renters and tenants who don't have access to cooling, that greenhouse gas emissions should not be a barrier to their right to cool. So that's something that we've heard from other jurisdictions. That said, there are certainly ways to stay cool during an extreme heat event that don't require air conditioning. And this is where, when we look at other jurisdictions like the BC Heat Dome, those who fared better were ones that had help and community members nearby, particularly older adults. So this is where that community level integration, education, and support system would be so crucial to get through those days of heat exposure and to protect those who are experiencing the highest risk factors to heat illness and potential fatalities. So, essentially, I think that what we have taken from this report is that there are a couple of immediate steps, which is to do that outreach and education so that we have more neighborhood level community response. In terms of the longer term access to air conditioning, yeah, I would agree that it's very important to have a conversation about our energy mix and how we provide air cooling. Alex, did you want to add anything to that?
I think you covered it all.
So thanks for that. And BC, I assume you mean British Columbia.
Yes.
Yeah. So if I guess what I'd be curious about, if we're looking at countries, communities that are close to the equator, that that for as long as history, known history has been around, they have dealt with heat events that even today we don't imagine. Is there knowledge that we could be gleaning? And I'm just leaving. So the report's a great report, and everything in the report is correct. I'm not criticizing any of that, but I do wonder if we're missing some knowledge from from societies that have dealt with this for a long time, and it could be again that that I think they are dealing with them this way better than they are. But I'll leave that with you. Thank you for the report. That's all I've got. Madam Chair, quickly, I'm not sure which button I've got, but can you see me now? Is the video on or off?
The video's on. I can see you.
Okay, perfect. You can see the bottom chin. Lucky you.
Mhm.
Thank you very much.
Thank you. Any further questions? I want Councillor McDougall. Oops. Yeah, there you
I
go.
think my microphone's on. Thank you, Madam
Yeah,
Chair.
you're on.
Thank you very much. I just wanted to echo similar some of Mayor Foster's considerations, just in terms of thinking of all the travel that I've done in some warm climates, whether it be Spain or up in the high deserts of Oregon. Many hot days, but I mean the debates I've had with people in terms of, open your windows at night, close them during the day, close your shades. There's been many ways of dealing with heat for a long time, but certainly in Durham, the support for, planting more trees. I know that I've heard regularly that, oftentimes we don't have enough room for trees, but when I look around, I see lots of room for trees. So thank you for bringing the report forward. And just in terms of Mayor Foster's questions, is there anything, that perhaps in the report that would highlight there might be some natural ways for us to assist in people for cooling that doesn't require mechanical ventilation?
Thank you for the question. And the short answer is absolutely yes. We actually just created something called Heat Hacks for Staying Cool, and it's a resource that's on our HEAT webpage. And it provides some of what you've already mentioned in terms of shade and opening the windows at night. We do foresee some challenges if we plan or if we expect issues like wildfire smoke to happen at the same time as a heat event. So that's something we need to consider in our advice, and that's something we're working on. And then there are other important pieces that people can do in terms of taking a wet towel and placing it on their body. So all of those are listed in our Heat Hacks resource. The one thing I just think is worth mentioning that's a little bit different here as opposed to hotter climates is populations have adapted to the heat. So one challenge we have is when we move from the winter into the spring and the summer. So we know from evidence that the highest risk period is actually in the spring when the heat starts to spike, but people haven't had the opportunity to adapt. So that's a really important difference between our climate and some other hotter climates. And it's something that we know we need to include in our heat education, is to really get people to get ready ahead of the heat season before it comes, and be prepared, and to give themselves time to acclimate.
Thank you for
I
that.
can
And
also
just to,
add, oh, sorry.
yep, no, go ahead.
I was going to mention the acclimation, so I'm glad Tara did. But one thing, just thinking about it a little bit longer, one thing that is a more common thing to do in countries that experience very hot temperatures is to actually sleep outside at night. So in, I think, some Arab countries and some other South American countries, they'll actually sleep like on their roof if it's a really, really hot night, because it's actually cooler outside of their homes than inside of their homes. So although that's not something that we generally think about doing, that might be something that is low cost, really easy to do. There's definitely a vector-borne disease component to it, but sleeping outside in a tent if it's really hot, or maybe doing something like a park sleep with lots of people, that is an alternative that would come from other communities, and I think is a really fun idea. Thank you.
Thank you. And just to follow up, in terms of technology, if you put your iPhone on the dash, it'll shut off automatically if it gets too warm. Is there any technologies that would track, say, I'm thinking of older adults, particularly when I saw heat waves go through Montreal, and it's usually older adults on an upper floor in an apartment that are isolated that will just, get too hot and not realize it. Is there any technologies that exist that would help them to track and know that they're probably too warm, similar to our phones?
That's an excellent question, and that is included on our heat hacks resource. And essentially, the best way is to take your temperature. But
Okay.
it is a real challenge, though, because a lot of older adults can't sense the heat, so they may be experiencing heat illness, but not sense that they are overheating themselves. And so this is why we really want to push our communication and make sure that their support network is aware and checking in on them and has means to do that. And there's even within the heat hacks, there is a resource that helps people to do these heat checks remotely. So if they have a loved one who they're not living with, they are given a checklist of what to do, what to ask. And it's an excellent resource. It was created by the National Collaborating Center of Environmental Health, and they'll be putting out a video to go with it soon. So we hope to share that soon.
Okay, thank you. Thank you very much.
Anything further? I have one question, and it's regarding the communication. And I know you spoke about reaching out to the loved ones, but those who are within many of our apartment buildings, social media clearly is not probably an access that they have. What mechanisms are we looking at alternate communications to trying to get to some of the seniors within some of these buildings, especially within our downtowns?
That's another excellent question. I think that's something that we have to look at further. I know that the National Collaborating Center of Environmental Health did an assessment on media and how we communicate about heat, and came up with several recommendations that are about to come out. And it included doing interviews with many health units, that what we're doing. And so we expect that they soon will be releasing recommendations, because right now, most of the messaging and outreach has been about staying cool during the daytime, where we know from the evidence that a lot of the fatalities and mortalities occurred overnight indoors. So we're waiting on those recommendations, but that's something that we would have to explore further.
Okay, I appreciate that. Tara and Alex, thank you very much for this presentation this morning. It's very informative, and some great questions as well too from the members of council. Have a great day.
Thank you,
gonna
Madam
move
Chair.
on.
Thank you.
You're welcome. We're going to move on. We have no delegations, and moving on to health. Within health, we have one report, and it's relating to 2 Ford Explorers to support community program for long-term care. Can I have a mover? Chair Henry, have seconder? Councillor Jubb, is there any questions? Mayor Foster,
Thank you very much.
can you bring your microphone closer to your mouth, please?
I can do exactly that. Thank you. So just a really quick question. This, we had some unanticipated funds, which is great, a surplus. Is this a priority? And I know you wouldn't have brought it forward to us if it weren't, but in a world of unsheltered, in a world of addictions, mental health, we're picking up a couple more vehicles. So I'm just curious about that.
Happy to get the answer. Dr. Kyle?
Yes.
Dr. Kyle, I did ask you to be concise and straightforward in your answers, and you were, and I will accept that. Thank you.
Any further questions? We love Dr. Kyle. Any opposed to the recommendation? Seeing none, hearing none, moving on to social services. And we have correspondence that has been pulled. I have Councillor Neal hiding in the corner here. Councillor Neal, do you have questions to the correspondence that you pulled?
Yeah, we're talking about the actual report from the commissioner and the director. Okay. Yeah, thank you very much, Madam Chair, and I'd like to thank Commissioner Daniel Pappas-Constantino and Director Gaskin for this report. Now, this report basically highlights the the 2025 Canada-wide Early Learning and Child Care Funding Model Update, and I appreciate you bringing this forward. But I see there's a challenge here in one of your, I think it's 4-point challenged in this report is insufficient supply to meet the increasing demand. And I guess that's the bottom line with this is, and I'm finding that one of mine, I don't know how many there are across the region, Commissioner. I mean, maybe you know. I just know the one that I'm dealing with. And Arlene, who runs the one in Columbus, it's been there a long time and is well known and highly regarded, has a lot of special needs. I was there and there's no breaks. It's constant. It's constant because there's like autism, there's verbal, and there's Down syndrome, and there's so for loss of funding for a daycare like this and loss of care, like her letter states, and I don't know if everyone's read the letter, because they were so busy there at the things, they didn't even have hardly time to get this together. I just got it this morning. So is there something that the commissioner, through you, Madam Chair, can comment on? I see there's something in the report about profit, but what about the nonprofit center like the Columbus one?
Commissioner?
Thank you for your question, Councillor Neal. I will pass this over to Director Julie Gaskin. I just wanted to highlight that the Canada-wide Early Learning and Childcare Program is a program that was open to all for-profits and not-for-profits, including the municipal sector. So, and this particular organization is the nursery school side of the sector. So I'll leave it to Director Gaskin to comment further. Thank you.
We're working on it.
Okay. There we go.
There you go. You're on.
Thank you. Thank you very much. Thank you for bringing this question forward, Councillor Neal. Through the chair, we currently have 271 childcare centres that are enrolled in CWELC and 42 that are not. Most of them are for-profit childcare centers. A few of them are the not-for-profit childcare centers. The rules are the same for both for-profit and not-for-profit childcare for enrollment in the Canada-wide Early Learning and Childcare System. We call it CWELC. So if you hear me referring to CWELC, that's what I'm speaking about. we, when the announcement was made that the funding model was changing for 2025, it was going to move provincial funding over to the federal program, which was part of the federal provincial agreement. So with that adjustment, some centers are going to lose funding. Those 42 centers that I mentioned, they will lose funding, and that's funding to support wages. If they have a service agreement to provide fee subsidies, it's that as well. And it's worth noting that the supports that we provide to all childcare centers for children with special needs, we are able to continue to provide the services that our special needs resourcing agencies to go into the centers and support the educators in the work that they're doing with those children. We just won't be able to provide the additional small pot of funding that some centers get to increase the number of staff that they have in program.
Further?
Okay, well, thank you very much for that. I guess this issue has, I guess, made it very, very difficult for us, like the one in Columbus, to carry on. But now, like I thought it was around 39, there's 42 that are basically in the same situation. And that's in the region, or like
Yes, that's in Durham Region alone.
that's a lot that could be.
Well, as Commissioner Danos Papaconstantino noted, the majority of those centers had the option to opt in 2022. From March of 2022 till December 31st, every licensed childcare center that was operating in Durham at that time needed to decide if they would opt in to CWELC or opt out of CWELC. And the majority of those 42 made the decision to opt out. Since, as of January 2023, the only expansion of CWELC centers or spaces can be done through the growth, our growth targets that we were given by the province. So each target is connected to money. If we don't have the funding, we can't opt them in because we won't be able to pay them. We won't have enough to support that system. So again, as of those 42, the majority of those, including the center in Columbus, chose to not opt in 2022. And now with the growth targets, it's a different opt-in process. So we're not able to because we have insufficient directed growth.
Okay, well, through you, Madam Chair. But that might change, right? Things can change. This isn't hard and fast, and with the region lobbying, and I really want to thank you, Director, as well as the Commissioner, for doing what you can. And I know you've been in constant contact, especially with the Columbus one. Is there a chance that things could change, or things could not be as hard and fast as they face reality now? We have like special needs children. Like I say, there's no rest at some of these places. So is there a chance that something further down the road could be done?
Yeah, thank you for that question. And through the chair, we're hoping there could be a reallocation of spaces. Some municipalities aren't able to use their full growth allocation. Durham Region only got 2,029 spaces for 5 years. It's not much. We have been routinely requesting more since 2023 when we got those targets. The province has said that they're going to look at potentially a readjustment of where those spaces are provincially. We submitted all of our information to the province about a month and a half ago, and have not received they haven't provided an update on that. So I'm not sure if that's happening. We're unsure if we'll get more, if it's going to be happening or not. The CWELC agreement expires in 2026, so that'll be a brand new start to that provincial federal agreement. So it is possible that additional spaces may be made available after that agreement is established. And it is worth noting for special needs children, our division has supported different programs to go in and provide consultation services that support children with special needs in childcare, as well as some funding. We will continue to do that. And historically, the region has overspent. We're required to spend 4.1% of our allocation, and we've historically spent somewhere around 9% of our allocation to support children with special needs in childcare. It is a very, very important thing to do for families.
Okay, thank you very much. And I know the MPPs and MPs have been advised of all this because I've made sure that that has happened. So I really thank you. Thank you.
Thank you, Councillor Neal. Is there further questions on this report? I need a mover to receive for information. Chair Henry, second, please. Mayor Carter, any opposed? Moving on the agenda, we're going to item number 10. 10.1 is a report. It's a confidential matter. Is there any reason to go into in camera on this matter? If not, need a mover on this. Chair Henry, seconder. Mayor Carter, any opposed? Moving on to other business. Does any member of the committee or other have Mayor Carter?
First of all, good morning, Madam Chair and staff. Madam Chair, I'm just wondering, I'm wondering if you need a motion or if you want to notice a motion in regards to this item. And I'm just wondering if we might just have a short, brief question about this. I know that we did an investigation for 1635 Dundas Street in the beginning to be able to see if it would be suitable in regards to providing the services that the region is committed to. I'm wondering if we could do the same thing in Oshawa. We've got a new or older facility that'll be coming available, and that is the old Grandview Children's Center headquarters at 600 Town Line Road in Oshawa. And I'm wondering if there would be an opportunity for staff to investigate the opportunity to look at purchasing either Grandview Children's Center headquarters in Oshawa and look at a similar model of 1635 Dundas Street and see if that's even possible, feasible, what type of resources. And I'm just looking for your direction, how you would like to kind of look at the possibility of investigating this.
I think the simple answer is yes.
Boy, you're a good chair. I got to tell you that.
To investigate it, absolutely. Chair Henry.
Madam Chair, I think it would be easy if for staff to take it as direction versus putting a motion on the floor.
Yep.
I'm getting a nod.
Oh, that's.
I'm getting a sort of a nod from the commissioner, but I think that would be the proper process. So I'll leave it to you, Chair, to decide.
Yeah, and I'm in agreement, and Mayor Carter,
Okay.
so is the commissioner. So you got a yes.
Yeah,
Look
great.
at that.
No, that's fantastic. No, I just didn't know how you wanted it handled, and I know the property's coming up. So if we could even take a gander at it, and I know there's a lot of pressure on a lot of the budgets, and I get that, but I just thought that if we did an investigation and then found out if it's feasible, that would be great. So I appreciate the opportunity to ask the question, Madam Chair, and I hope you have a good day.
You too. Mayor Foster.
Thank you, Chair Roy. Just on that really interesting idea, please, because sometimes we view borders as very hard things. That is right on the border between Oshawa and Clarington. So if we're looking at residents, please include Clarington and the Clarington residents in that discussion. But
This is
really
going to be
interesting idea.
so
Thank you.
easy, Mayor Foster. The answer is yes.
Yeah, well, don't keep doing that because I might come up with a really big. What do you think, Mayor Carter? What should we ask for while the chair is saying yes to everything?
Oh, you already got the yeses from me today. Then the rest are no's.
All right.
Oh, now
we're
Mayor,
done.
now
We're done.
Councillor Jubb's coming up.
Thank you.
Councillor Jubb.
Thank you, Madam Chair. I don't need a yes or no. Just a question to staff. I'm wondering if we can get just a very Coles Notes brief update on Beaverton Heights. I realize the first residents are coming in probably in the next week, so just a quick update would be great.
Okay. Who would you like to give the update, Commissioner, on Beaverton?
Yes, thank you. Through you, Madam Chair. My director just dropped off, so I will provide the update. No, that's okay. So we did get our occupancy agreement last week. Thankfully, our facilities group are doing a little bit of work that wasn't part of the original contract with the builders, so they're just finishing up a few things. We're looking at I would say more like the 18th, having our first resident start moving in. They're all from North Durham right now, the ones that are being interviewed and connected to the services. And out of our 10 developmental services folks, I think 7 are confirmed right now, and we're working on the 3 more. So, and we're phasing in sort of a 10 at a time. Grouping just to help, obviously, with everybody to get settled and the staff as well from Blue Door. And that's my update, Councillor Jubb. Is there another question on that?
No, I think that pretty much covers it. I just wanted the public to know. I guess one follow-up question. All the agreements and concessions that are in the memo of understanding, Stella, that'll be in place before the residents arrive on site, like such as security and whatnot?
Yes, through you, Madam Chair. Yes, we are working through to ensure that we're meeting the agreements as we agree to.
Okay, that's all. Thanks so much. That's all, Madam Chair.
Is there any further new business? Seeing none, hearing none. Motion to adjourn. Chair Henry, seconded. Mayor Carter, any opposed? Thank you very much, everyone. Have a great day.